Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in ophthalmology. Discover a new show at itube.net/podcasts.
This is Ike Ahmed.
And I'm Arsham Shaybani.
And we want to welcome you to GT the Podcast.
We're bringing this to you together with BMC and Glaucoma Today,
to offer audible insights into current topics in glaucoma care.
Presented by the authors of our latest, most read GT articles.
Check it out.
Welcome to GT the Podcast. In this episode, Dr. Neeru A recaps her article, The Role of Anterior Segment OCT in MIGS, which was featured in the March-April issue of Glaucoma Today. Her article explores how this mode of advanced imaging can enhance the patient evaluation and surgical results. Dr. Vallabh reviews anterior segment OCT's role in MIGS, including its utility for preoperative evaluation and intraoperative adjustments, its ability to provide insights into postoperative outcomes, and the technology's current limitations that could hinder widespread adoption. More on this now from Dr. Vallabh.
Anterior segment OCT has become invaluable for the diagnosis and management of glaucoma. First-generation instruments offered time domain and spectral domain OCT. Newer generation swept source OCT employs a longer wavelength of light, up to 1310 nanometers, and higher scan speeds, up to 100,000 A scans per second, which allows an improved axial resolution down to 5 micrometers. Currently available swept source OCT instruments include the Cassia 2, Anterior, and Triton DRI. Its ability to image the angle, Schlemm's canal, and trabecular meshwork gives anterior segment OCT a potential role in MIGS surgery. A comprehensive preoperative evaluation of the anterior segment is critical for identifying patients with an open angle who are suitable candidates for MIGS. The ability of anterior segment OCT to provide precise cross-sectional imaging of the angle facilitates the detection of structural variations in conjunction with traditional gonioscopy. Anterior segment OCT can detect narrow angles, iridotrabecular contact, and areas of peripheral anterior synechia. The newer generation anterior segment OCT modalities use swept source technology, giving them heightened sensitivity to detect even subtle anatomic abnormalities. The technology's precision occasionally leads to overdiagnosis, however, making the careful interpretation of findings essential. Anterior segment OCT has revolutionized MIGS by enabling real-time intraoperative imaging. With instruments such as the Artivo 800, surgeons can confirm an implant's position and make immediate adjustments if needed. This precision reduces the likelihood of malpositioned devices, which can compromise surgical efficacy and postoperative IOP control. Repositioning devices during surgery reduces the risk of failed procedures. A study by Ang, published in 2023, found that intraoperative OCT allowed real-time visualization of an overimplanted eye stent, with the flange observed to be flush against the trabecular meshwork. The same study described intraoperative OCT signs of an optimally placed hydrous microstent. Specifically, the absence of the tram truck and knuckle signs described in the study indicated incorrect device positioning. Anterior segment OCT can evaluate MIGS outcomes. In a prospective analysis, the protrusion of an eye stent was associated with lower postoperative intraocular pressure compared to overimplanted devices. Anterior segment OCT has also been used to evaluate the trabeculotomy opening size following trabectome surgery. One study found no correlation between opening size and IOP reduction. In Liverpool, anterior segment OCT has been used postoperatively to confirm the presence and also evaluate the pores created in the trabecular meshwork with an excimer laser trabeculotomy. All the aforementioned findings highlight the potential of anterior segment OCT to investigate whether specific structural changes achieved during surgery are predictive of clinical success. In the postoperative setting, this can allow us to track the gradual anatomic changes over time. This is particularly helpful for monitoring implant performance. For instance, it can be used to determine if a suprachoroidal implant is correctly positioned in the anterior chamber and monitor the size of the distal suprachoroidal space in correlation with clinical outcomes. Aqueous outflow beyond the trabecular meshwork is critical to MIGS efficacy. New generation swept source OCT can provide detailed images of the Schlemm's canal, an area of growing research interest. Studies have shown that the canal's dimensions decrease with age and primary open-angle glaucoma. The technology's ability to evaluate the impact of MIGS, particularly trabecular meshwork bypass and viscodilation, on the structure of the Schlemm's canal provides valuable quantitative insights. A prospective analysis found that properly placed eye stent devices resulted in greater Schlemm's canal diameters and lower postoperative IOPs. The dynamic active nature of aqueous outflow, its impact on Schlemm's canal measurements, and the need for precise delineation of this small structure should be central considerations in future research in this field. The limitations of this technology is that it provides static images of anatomic structures, which cannot capture dynamic changes in aqueous outflow in real time. Motion and blinking artifacts can also compromise image quality. The high cost and limited accessibility of these systems, moreover, may hinder widespread adoption of this technology. Advances such as automated landmark detection and enhanced intraoperative visualization may help address these challenges. The utility of anterior segment OCT for evaluating minimally invasive bleb-forming surgeries also warrants further exploration. In conclusion, anterior segment OCT can facilitate candidate selection for MIGS and accurate implant placement. The imaging technology can also provide important insights into surgical outcomes, including whether failure is due to incorrect technique or distal pathophysiologic unknown factors. As it evolves, anterior segment OCT may play an integral role in advancing the science and practice of MIGS surgery.
Thank you for tuning into this episode of GT the Podcast. If you have any feedback or topic suggestions, find us on Instagram, LinkedIn, Facebook, or Twitter. And stay tuned for more hot topics in glaucoma care on GT the Podcast.